Hello and welcome to the Telegraph Studios, where I'm joined by Alex Short, Consultant Eye Surgeon, and Claire O'Donnell, Head of Eye Sciences at Optegra. Let me tell you what happened before this interview. Our producer, he's got some new glasses. He went to the optician, got them measured, paid his money. It looks very smart. But what more do people need to do to look after their eyes?
I think the key thing is it's so important to have your eyes examined regularly. It's recommended that we do this every 2 years. One of the main reasons is to make sure that we're making the most of our vision by wearing up-to-date glasses or contact lenses if we need them. But arguably more importantly, it's a really good eye health check because there are a number of important conditions that can be a real threat to our sight. Let me give you an example. It's estimated that there are around 3.3 million people in the UK living with diabetes, which we know can damage sight. But there's approximately 600,000 people living with this condition that simply don't know they have it. And there are a number of other eye conditions, such as age-related macular degeneration and glaucoma, which again may not reveal any symptoms in the early stages, but again can lead to long-term damage to our sight if we don't know to get them treated.
I think that's right. So as a consultant eye surgeon, what worries me is that there's over 1 million people living in the UK with glaucoma, which is a potentially blinding eye condition, but which has absolutely no symptoms until it's quite advanced. And that's a perfect example of why people need regular eye checks.
You mentioned some pretty critical health problems there and some quite shocking figures. How did we get to this situation in the first place?
Well, as consultant eye surgeons, what worries us is the general level of ignorance about eye conditions and symptoms that may seem innocuous but could be the first signs of a serious blinding eye disease. And it may not surprise you to know that we have an ageing population, but what will surprise you is to know that the risk of developing a blinding eye condition increases hugely as we get older.
Knowledge is obviously key in this area. Who needs the more information and whose job is it to educate?
Well, I think knowledge is absolutely key. So the first thing is to know when to have your eyes examined. What are the key symptoms and signs that we ought to worry about? At Optegra, we offer open evenings where patients can come along and learn about eye conditions and the treatments that are available for them and meet with our consultant surgeons. We also write articles for the media and the press, again to share our knowledge and information, and we commission our own research programmes, and a report entitled The Vision of Britain is about to be published to support the public in this regard.
I think it's important that if patients think they have any new visual symptoms or they may have a problem with their eyes, they should always seek a consultation with a consultant eye surgeon.
On this note, we've been on location to one of your eye hospitals and we've caught up with Rob Morris, your medical director, and we've asked him the most important things to do while looking after your eyes.
First of all, is it important for everyone to have regular eye checks?
It's important for people to have eye checks, but not everybody needs regular eye checks. Certain groups of people need eye checks. The over 50 age group needs regular eye checks because it's most eye disease is age-related, and so the older we get, the more at risk we are. Diabetics, it's important for them to have eye checks, and the NHS does provide a screening service for diabetics. If you have a family history, particularly of glaucoma, it's important that you're screened regularly by your optician. And people wearing glasses and contact lenses, it's important that they're regularly seen and checked up.
You say contact lenses. Tell me a little bit more about that. Why are they particularly vulnerable?
Well, contact lenses are very widespread in the community now, and a lot of our contact lens wearers are young people. Young people travel, they party late, and they don't necessarily pay meticulous attention to the hygiene of their contact lenses. They will often overwear their contact lenses, sleep in their contact lenses. They may not change their lenses or their solutions regularly, and all of these things are important. They're important because if you don't observe the rules, you are at risk of developing blood vessels on your cornea, which is sight-threatening, and more seriously, an infection, which could have serious consequences.
Now, those are some symptoms, but what are the main symptoms that we might have that means we shouldn't ignore them, we need to get help?
Well, the acute and urgent symptoms we need to take into account are a sudden loss or deterioration of our vision, a sudden episode of flashing light or veil-like floaters in our vision, persistent pain, and persistent sensitivity to light, particularly sunlight. Those are all warning signs that you may be developing an acute eye condition that needs urgent attention. The options that might be available for you to seek attention would include your local optician, your local GP, or if it's out of hours and you think it's an emergency, most hospitals have specialised eye departments that have an emergency facility.
We hear a lot about tablets and computers. Are they actually bad for our eyes?
The computer and tablet and PlayStation story on our eyes is very interesting because it's a common myth that they damage our eyes, which they don't. They do, however, influence our vision. And the reason they influence our vision, and this has been documented by videoing people playing video games, is that when we use computers and videos, we blink 3 to 4 times a minute. The normal blink rate is 20 to 30 times a minute. Consequently, we don't wet and lubricate our eyes. So it's a common complaint that at the end of the day or the end of a long session on the PlayStation, people say their vision is blurred. And it's simply because the surface of the eye has dried out. And the remedy, of course, is to take frequent breaks from the computer, consciously blink if you have symptoms, and it may be that you require help from an eye care professional to advise you on the use of artificial teardrops.
So some important tips there. Let me go back to an earlier comment you made about it's important to train the professionals as well. And you're running events about the future of healthcare, and there's one which is starting in Guildford today, where we have our reporter, Alistair Greener, down there. Good evening, Alistair.
Good evening.
Tell us, what's happening?
Well, I'm here at the Future of Eye Healthcare event, which is actually part of a series of events around the country. And I'm joined by Rory Passmore, who's the UK Managing Director of Optegra, who are hosting these events. So, Rory, what's going to actually happen this evening?
Well, this evening we're bringing together the medical community to hear about what the future may hold in terms of advances from a technological point of view and from a treatment perspective. We've got the world-renowned Dr. Patrick Dixon, who's a renowned futurist, speaking and addressing the group.
So what do you hope to achieve out of the event?
We're hoping to achieve a closer collaboration between the referring community, the GPs and optometrists, and the consultant ophthalmologists. Their continued working together is key to make sure that the patients are getting the best possible care that is around.
So tell us about the bigger picture. How does this fit in with Optegra's major strategy?
Well, Optegra is committed to making sure people are able to live fuller lives through the sight that they have got. And so these events will make sure that the medical community are working together. We are using all of the latest technologies that are available. And in fact, when we open our brand new hospital in central London, just off Harley Street, we will be employing all of those brand new technologies in a new £13 million development.
This is obviously one event, but what other ways are you aiming to educate professionals?
We do a number of things, whether that be hosting webinars where we can give information, academic papers through our consultants, which advances their research, or continuing medical education events for the optometrists, where we get the consultants and the optometrists and GPs together so that they are aware of what the latest technologies and advances that are out there.
Rory Passmore, thank you very much indeed. And from us here in Guildford, it's back to you in the studio.
Many thanks, Alistair. Very interesting. So, a lot of people to educate there. It's a very ambitious plan. What are the biggest obstacles?
We work very closely with optometrists and GPs. because eye healthcare is such a fast-changing speciality. I head up Optegra's Research and Development Division, Optegra Eye Sciences, where we get to work with key academics and industry in helping to move the latest treatments and technologies forward. And we are very eager to share this and support optometrists and community GPs in this regard.
So, are you optimistic about the future?
It's a very exciting time to be a consultant eye surgeon. So partnering with Optegra, we're bringing together some of the best eye surgeons in the UK with some of the most incredible technology, and having these together in one place is a really unique opportunity. But the other thing that's really exciting is using stem cells to treat blinding conditions which otherwise patients would remain blind. So, for example, my personal interest is using stem cells to treat blinding corneal disease. And at the moment, we can restore vision to up to 300 patients per year who would otherwise remain blind. But just if we take that forward and apply this technology to other eye conditions, we have the potential to restore vision in thousands of patients every year who would otherwise remain totally blind.
It all sounds very exciting. Many thanks.